21 years ago, I lay bleary-eyed on a pull-out cot in the storage closet of a neonatal intensive care unit. 3 days prior, I had delivered premature twins, and I was overwhelmed, stressed, and grateful they were alive. I was shocked that the hospital was ready to discharge me so soon, and as a favor, the social worker found the storage closet as a place for me to stay for a few more days. This is the hospital and university, the very NICU that I had been trained in and was now faculty pediatrician in. I felt desperate and stripped of control, and in the moment, I remember wondering, what happens to other moms and families in this crazy, high-tech, and fragmented system? My name is Anda Kuo. In addition to raising 3 kids in the San Francisco Bay Area, I've spent my entire career as a pediatrician at a public health hospital. And living and working in the Bay Area, I've experienced the inspiring depth of services and programs in our community and the huge heart of the Bay Area. And also, the unnecessary complexity and confusion of our systems that surround these services and make them inaccessible to families who need resources the most. In spite of efforts to map resources and disentangle our processes as a system, we just seem to create more and more webs with families and, frankly, providers trapped, trying to navigate their way to access help. No one individual or agency is going to be able to will their way to clarity, and trust me, I've tried. Systems problems need system solutions, and it requires us to partner and build community. We launched such a community in 2019. It's called TONIC, the Toxic Stress Network Improvement Collaborative, and is focused on young children and is accountable to our family leaders who drive our priorities and efforts. TONIC has the right people at the table: families, managed care plans, child welfare systems, healthcare providers, city agencies, and community organizations. This quote from one of our family leaders is core to our mission. Why do traumatic things have to happen in order to get support? And the truth is, they don't have to happen. At TONIC, we work with families via our family board, who are our strongest partners, to create preventative strategies and programs that families can easily understand and utilize. We create the collaborative space for early childhood leaders to openly address challenges and solve real problems in delivering quality care. We pilot innovative care management programs. We make sense of complicated state Medicaid policies and make them real at the county level. We produce policy papers, resources, and toolkits, and disseminate our learnings with the state to support other counties. Over the last 6 years, we've seen our model make lasting change for families in the Bay Area, and here's just one example. Together, TONIC leaders developed a plan to sustain a new pilot program that integrates behavioral health specialists into San Francisco's busiest public health clinic. Simply put, through TONIC's cross-system collaboration, we ensured that the clinic had a sustainable mechanism to provide dyadic care, supporting children and their caregivers with their physical and mental health. Using evidence gathered from the pilot, our partners successfully advocated to make dyadic care a recognized and reimbursable benefit of Medicaid, closing a gap in access to care that has the potential to improve the well-being of over 5 million young children and young adults on Medicaid and their families across the state. Our current focus is to support children exiting the foster care system by using Medicaid benefits so that these children can thrive and avoid re-entry into the system. The feedback we've received is clear and consistent. The conversations that we have and the work we do not happen elsewhere. This work is challenging, but the outcomes are powerful and can change the lives of countless families. Now we want to continue this work, documenting our process and disseminating as we go, so what we demonstrate locally has broad impact. California has invested $4.4 billion in Medicaid reform. We have more than 5 million children and young adults in California on Medicaid. TONIC provides an opportunity to disentangle our system webs and connect children and their families to much-needed resources. And that's what we do so well. With a bold vision for sustainability, we are on track to fully fund this critical work for the next 3 years, $1 million of funding, as we create a ramp from private to public sources. This funding supports our dedicated team, including our family leaders, and the timely development of resources to share our learnings and have a broad impact. To date, we've secured $500,000 and are seeking partners to join us on this journey. Together, we can redefine care for millions of young children and their families who need support the most. Come join us.